Looking at the Orient Gene Rapid Diagnostic Test for COVID-19. This is the antibody test measuring both IgG antibody and IgM antibody. The IgM antibody is a marker of recent or acute infection, and the IgG antibody is a marker of a measure of protection or immunity against infection. The IgG band is the one that we're not sure the duration of. Are you immune for as little as 4 weeks or 4 months or 4 years? And therefore we would recommend that this is repeated if you're IgG positive to ensure that you maintain this protected state. I'll just show you what the kit comes with. Obviously we've got the test cassette itself. We also have the buffer solution. We have added the swabs just to clean the finger, and the auto lancet. And within the cassette, if I just open it for you, is the cassette itself. I'll explain that to you in a second. And in here is the little pipette that we use to take up the blood sample. On the cassette itself, there is a B well for buffer and an S well for sample. Don't get these two confused. B is not for blood, it's for the buffer. S is for the blood sample. And then the actual test itself, you have a C control arm that has to change colour for the test to be valid. And before that you have a G and an M. Any line at the G is IgG positive, any line at the M is IgM positive. Those lines can be as pink as the control, and you'll see the change soon when we do the test, or they may be faint, but any line there is a positive. So we'll just do the test now. What I recommend is you try and have a subject who's got nice warm fingers, and they're quite warm. We're just going to clean the fingertip now, and then we're going to use the automatic needle. So a little pinprick coming up. Okay, there's our little blood sample coming. These pipettes are universal. They're quite tricky to use, but if you hold them low down, you can suck the blood sample up and into the S well. We'll just do one more drop. That's enough blood in the well, and I'll just give you a little swab to press on there. So I'm now going to add 2 drops of the buffer solution in the other well, and that is now the test running. A positive result very often is seen within a couple of minutes. A negative result, you ought to wait the full 10 minutes before declaring a test is negative. Hopefully soon you should see the fluid, and we can just start seeing the blood being drawn along the cassette. You can see that the line has just got to M and is travelling slowly up towards the control line. So we have arrived at the G, and we're slowly making our way up to the control line. So far, we can't see any lines at the M or the G mark. We need to make sure that the test is valid though, so we are looking for that blue control line to change colour. And you'll see soon the blue colour gets dragged away and leaves behind a pink line, which means that the test is valid. I think you can see now the blue colour slowly moving along the cassette, and you're just getting a hint now of the pink line that's left behind. Obviously, so far we've only been going for about 60 seconds or so. The test is looking negative up to now, but valid because you can see clearly the pink line at the control. Now we would wait a full 10 minutes to declare this a negative test for sure. This is now coming back to our antibody test. A very obvious pink line at the control arm, a little bit of smudging, but that can be ignored from the blood staining. However, no line at the M or the G point going across the cassette. Again, these can be weakly positive, fairly faint lines, or they can be even deeper than the control line in terms of colour intensity. But this is a negative test.